Hello, everyone. My name is Miriam Mutebi, and I'm a breast cancer surgeon based at the Aga Khan University in Nairobi, Kenya. Today, the Commonwealth family joins advocates from across the world in commemorating the Day of Action for Cervical Cancer Elimination, 3 years after the launch of the Global Strategy for Cervical Cancer Elimination. This is a particular area of concern around the Commonwealth, given our high burdens of disease, where we know that 40% of all cervical cancer patients are diagnosed within the Commonwealth region, and 43% of all cervical cancer mortalities are found within our borders. And what should galvanize us all is that if left unchecked, this number will continue to increase to about 55% by 2030 of all global cervical cancer patients, and an attendant increase by 62% of all cancer mortalities, unless we start to critically think around how we can shift narratives around this. And so over the last few years, there have been several attempts in the Commonwealth to really start to engage with and address these concerns. In 2021, the Commonwealth International Task Force of Cervical Cancer Elimination, which I am chairing, was launched with the aim of supporting the Commonwealth Secretariat's cervical cancer elimination initiatives and associated activities. And through this task force, we worked tirelessly to elevate the cervical cancer elimination agenda. And this has resulted in a number of significant wins. As to date, our heads of state, of government, have committed to making sure that all girls by age 13 have access to the human papillomavirus vaccine by 2025. This commitment was recognized globally as a landmark event highlighting the Commonwealth's preparedness and leadership in eliminating cervical cancer. We've also tried to work at a more grassroots level in building a wide community of advocates and leaders to help raise awareness of cervical cancer. And this includes our young people and our first ladies and spouses who have really taken up the mantle and have committed to acting as champions for the elimination of cervical cancer. In partnership with the Lancet Oncology, where some of our members are commissioners, we are working on assessing the current state of cancer control provisions in Commonwealth nations with a focus on investment and implementation of pragmatic solutions that really help to speak to the needs of our patients on the ground. I'm also incredibly proud that our young people have continued to amplify their voices using the Commonwealth Youth Task Force on HPV and cervical cancer, which really strives to amplify the voices of young people globally and their contributions, and has really been an immense opportunity for intergenerational learning. As we commemorate the 3rd year of the global strategy, I think we must not be complacent. As the chair of the task force, my work is to continue raising this agenda higher, as 2030 is not too far along the horizon. I think there are a couple of strategies that we could employ. The 2024 Samoa meeting, for instance, will be an opportunity which we can use to galvanize the discussion and come home with some concrete actions for our heads and our policymakers. I think there's also an opportunity to really think through how the 2023 UN high-level meeting declaration on universal health coverage is really an opportunity for us to think about how we can anchor cervical cancer elimination under this broader UHC umbrella and really try to explore the continuum of care all the way through from the diagnostics, treatments to eventual survivorship. My call today is to ask us all to join in this fight. I think the key point is there's so much more that we can do collaboratively. Let's help to disseminate this information further. Let's help to ensure that we bring all stakeholders to the table such that years from now, our sisters, our daughters, our aunts, our friends, our relatives, any woman on this continent and this planet will thank us all for these efforts that we are doing now. Thank you for your attention.